Residencies. While typical and even required for professions such as medicine, pharmacy, and other healthcare professions, the RN residency is a relatively new program, which many see as an advantage to new graduates and healthcare in general. In this presentation, we will be discussing the transition from school to acute care nursing settings, the need for RN residencies, admission requirements, training and outcomes of the program, and also plans for the future of new RN graduate residency programs across the country. Nursing school is an intensive program, as all RN graduates know. There is so much information to be learned, clinical skills to master, medications to memorize. But nothing prepares a new graduate RN for their first job like their first job. Due to the acuity of hospitalized patients and the complexity of the typical acute care hospital, it is impossible for even the very best baccalaureate school of nursing to prepare new graduates to work in today's acute care environment. Many nurses have an excellent foundation to start their clinical practice, but there are many other things that factor into transitioning from a school program to the real world of nursing. Although new graduates have gone through many clinicals during their nursing program, it has all been limited by a lack of degree and different clinical instructors or preceptors who may have let them do a lot of skills, but not necessarily figure out how to run a shift. Inexperience, while not bad because every nurse was once inexperienced, can cause a lack of confidence. Many new graduates report questioning everything they do, even if they've done it before, and most say they feel stressed about absolutely everything. Another stressor is relationships with colleagues. Many times, new graduate RNs feel intimidated by other, more experienced nurses who know so much more than them, especially if they seem unapproachable or are not helpful and understanding. While new nurses have a lot to learn, everyone still wants to fit in and be accepted by their coworkers. New graduates often feel a barrier between them and more experienced nurses because they feel intimidated, and this can be exacerbated by nurses who are unwilling to help in their newest employee's transition. Acceptance is important for nurses, and this is an area where eating our young can really affect a new graduate. Other areas that new graduates struggle with include organization and prioritization, communication with doctors or charge nurses, and critical thinking in decision making. Because most have followed preceptors or clinical instructors throughout nursing school who have told them how to organize their day, when the new graduate starts their first job, it is challenging to use time effectively and stay on top of everything with a busy shift. Communicating with doctors can be unnerving, especially if the doctors ask questions that the new grad is unsure of. In the end, high levels of stress can affect not only the personal lives of new graduates, but cause high level of turnovers in new grads and a decrease in good decision making because the nurse has a difficult time coping. While not all nurses have difficulties in these areas, it is safe to say that all new graduates have struggled in some way as they learn to transition from school to the professional world. This, ch- this chart shows the stages of a new nursing graduate professional role transition. From research, this transition typically takes about 12 months for the nurse to start feeling comfortable and being able to handle stress, decision making, and prioritization. While not all new graduates follow this chart exactly, and the stages of transition do not last a set number of months, this was found to be the average for new nursing grads. As you can see, the first 3 months of the transition is an adjustment to new roles and responsibilities, and realizing that there is a difference between theoretical orientation in school and practical focus at work. After 5 to 7 months, nurses have a change in their perception of their experience, which helps them focus on what is important, search for productive ways to work, and start settling in. This stage is a transition from the first survival months, where the new graduates were simply trying to stay afloat. At 12 months, the nurses have settled much more into their role. While still learning, they're able to work with stress for their benefit and their patients as well. They have settled. As you can see from the many transitions new graduates must go through, as well as the length of time it takes for a new nurse to settle into their role, RN residencies can be very beneficial in reducing stress, providing experience, and learning continuity of care. New graduate residencies have shown that the reduction of stress, mentors put in place because of those the new graduates are training under, and additional specialty specific education has decreased the turnover rate as well as increasing nurse satisfaction within the first year. While graduate residencies are seen as beneficial, the government does not assist with funding for RN residencies, and it is funded solely by the hospital providing them. Although this is an additional expense, many hospitals have found that a decrease in nursing turnover, well-trained staff, and good teamwork are all incentives to continue and expand new graduate RN residency programs. Although many hospitals are requiring RN residencies for new graduates to be hired, the process can become quite competitive with so many new graduates searching for jobs. Typical admission requirements include a BSN degree, less than 6 months of experience, completion of the nursing program, and being board certified. Additional qualifications, certifications, high GPAs, connections, and good references all increase the chances of a new graduate being accepted into a residency program.
Training within the residency program includes a variety of methods. These include working in a simulation lab, classroom time where you will hear lectures from different professors and nurses in the hospital, precepting with a nurse on the hospital floor, mentorship, and looping to the other departments of the hospital. The lengths of the different programs vary depending on the hospital and the area they are to be working in. New grad programs can range from about 8 weeks up to a year and a half, although the majority of these programs last for about 2 to 3 months. The specialty areas such as critical care or ICU, perioperative units, and the emergency department are some of the longer programs. But no matter the length, these programs include a lot of the same components and objectives. In simulation labs, this is a time for the new grad to experiment and learn what to do in critical, real-life scenarios without the fear of hurting their patient. The new grads are in a safe and controlled environment, and their patients are simply high-tech mannequins which are able to simulate different medical issues. This is a great way for the new nurse to learn critical thinking in many different situations. A lot of times, in the hospital setting, the new nurse may be timid to do something for fear of hurting the patient. By practicing in the simulation lab, the nurse will gain confidence in their abilities. Classroom time is very similar to class in nursing school. You review topics such as congestive heart failure, acute kidney injury, stroke, diabetes, and many other topics you first learned in nursing school. Other classroom activities include practicing with lab and diagnostic interpretation, determination of emergent conditions and appropriate responses, priority setting, delegation, infection control, nutrition, age-specific issues, communication, skin care, blood product infusion, pharmacology, stress management, and many more. The educators will help you work on learning to prioritize. For example, they may give you several patients with different problems, and you will need to prioritize your care. You will also learn how to problem solve and use your critical thinking in difficult situations. You may also do many case studies where you will have a specific situation and patient, and you must analyze the situation. Classroom time may also include lectures from other hospital employees, such as a respiratory therapist, a physical therapist, someone from infection control department, the pharmacist, and many others. Although research shows that classroom fatigue has been a common problem, so many programs are now trying to incorporate more interactive activities to keep the students occupied. The new grads will get paired with a nurse who has worked on the floor for at least a couple of years. The preceptors will assess and evaluate the new nurses and give feedback to help them grow and adapt and learn. At first, they begin working side by side with the new nurse, and they provide plenty of instruction and guidance. They are the ones who do most of the work and patient care in the beginning. As time goes on, and the more the new grad grows, the role of the preceptor changes to a more supervisory one. The new nurse will now begin to take the lead. Overall, the preceptor guides the new nurse in the beginning and teaches them how to deal with difficult situations, and they will help them establish their own routine. So now the new nurse will start doing more and more until they ultimately take over all the care, with the preceptor mainly supervising. In most programs, you may be paired with a mentor. This person may be the CNO of the hospital supervisor, maybe the clinical educator, or even a charge nurse. The purpose of a mentor is so that the new grads will have a resource, someone who has been through it all and has wisdom and experience to share with them. Mentors aren't as hands-on as the preceptors. They won't teach you clinical skills. They are mainly there to listen and to help sort out through fears, and they will also give advice and help the new grads adjust to their new roles. They are there more to be an outlet to vent and to provide encouragement and advice. Visiting other departments and units, or looping as my residency program called it, is a great way to become familiar with the hospital you will be working in. As nurses, we work very closely with other departments in the hospital, so having a few hours where the new grads visit other departments will greatly benefit them. They can see what these other departments do and ask them questions about how they will be interacting in the future. They will figure out the best ways to communicate with these departments. Some examples of departments are the pharmacy, the lab, ICU, the emergency department, case management, respiratory therapy, palliative care, and the list goes on and on. Outcomes for a residency program include the new grad beginning to learn how to think critically. They should have started to develop better technical skills, such as starting IVs, inserting Foleys, passing medications, and many more. Their scope of clinical knowledge will have expanded to include much more information. They should have better time management skills and better prioritization skills. They will be more confident in working by themselves and may start to think about taking on leadership roles in the future. Because of the training they have received, they should make less errors than if they would have just started working without this training. And one of the big things is that they will be more satisfied in their job and enjoy it more because of this new confidence in themselves. After the program, they should feel more comfortable in their environment and be able to take care of the more stable patient populations. They now need time to adjust to their new jobs. They will still need to gain more experience and work on their critical thinking as they go along. I do believe that more hospitals are going to start implementing their own versions of residency programs or versant programs, Studies do show better outcomes for those new grads who did join residency programs than the nurses who did not. Residency programs were made to make the transition from school to work easier for new grad nurses. Everyone knows that what you learn in school can only prepare you so much for the real world. Your textbooks can only teach you so much. With the help of these programs, the new grads are able to ease themselves into the actual hospital setting with the guidance of experienced nurses. With the implementation of more of these programs, we will bring more prepared and confident nurses into our hospitals and provide better and safer patient care.